Another real common problem that we see in this country is bad varicose veins in the lower extremities. Sometimes this is caused by blood clots that have formed in the leg veins sometime in your past. These blood clots, although they can dissolve over time, often injure the valves in the vein. And after a series of injuries to these valves, we develop too much pressure in the venous compartment of the lower legs. And this can be reflected as varicose veins, these veins you can see in your lower legs. And sometimes this can get to the point where we actually start to cause injury or damage to the skin in front of the lower calf in the shin, and sometimes this gets to the point where the skin breaks down and causes chronic non-healing ulcers. And when this happens, it's a tough problem to manage. Very expensive, requires a lot of medical supervision, and sometimes is something that you try to manage just to control without even expecting any kind of cure. But what we found is that patients who have obesity and a history of deep vein thrombosis, who are now struggling with these ulcers, and we'll show a picture of these here. If you have them, you know what they are. That in those patients who have morbid obesity, a big part of this problem is a huge belly. And a huge belly has a much higher pressure than a normal belly. And the blood from the legs has to go through this high pressure zone to return to the heart. And sometimes we find that patients who have obesity and chronic stasis ulcers, these ulcers from venous hypertension of the lower extremities, these ulcers actually heal for the first time after their weight returns to normal. And I think it's mainly a function of the belly getting smaller, the pressure in the belly cavity getting smaller, and the blood flow improving from the legs, allowing these ulcers to heal. And this is very exciting. This is something that I think is a reliable way of addressing this very, very serious problem without that up until this time didn't really have a good solution. So I think that patients who have morbid obesity, who are candidates for bariatric surgery, and who have these serious problem of venous hypertension in their legs, can expect these things to get markedly better after successful weight loss.